Well, it's American Heart Month, so all month long we're bringing on Bon Secours experts to really help us learn about our heart health. And today we're talking about treatment options and really how far they've come. To tell us more about it, we've got Dr. Jonathan Hansen with Upstate Cardiology. Thanks for joining us.
Yeah, thank you.
As we're closing out Heart Month. You know, when we talk about heart problems, a lot of people immediately think, oh gosh, I'm going to have surgery. But you're telling me there's other treatment options available.
That's right, absolutely. There's many treatment options other than surgery. That's going to range from anything such as a healthy diet and lifestyle to a variety of medications.
Well, you've heard us now, just as we've been waiting to put this on air, talking about healthy, lifestyle changes. What are some of those things that people would look at? I hear sodium is a big one.
Mm-hmm. Sure, absolutely. So I would say the number one thing would be tobacco. Mm-hmm. Smoking at all is a major risk factor for a variety of heart diseases. But along with that, just a healthy diet, so avoiding saturated fats, things that's going to be mostly animal sources, meat, butter, dairy, egg yolks, all with lots of saturated fats. Also staying away completely from trans fat, that's going to be in your processed foods, certain restaurant foods.
See, it's when it's like cooking at home. Sometimes it's so much easier because you know what's going into it, you know what you're doing. Studies have shown that several classes of drugs are kind of best to treat heart failure specifically. Can you tell us a little bit about that?
Sure. So with heart failure, it's really a big topic, but we can break down heart failure into two main categories. That's going to be folks who have a normal squeeze function of the heart, which we could term a preserved ejection fraction, and those with a compromised ability of the heart to pump, which we term reduced ejection fraction. So for those with a reduced ejection fraction, there's going to be really four main classes of medications that we use to treat that. So first we have the ACE inhibitors, angiotensin receptor blockers, or ARBs, and then a third class of medication, which is an ARB combined with another medication called a neprilysin inhibitor. And currently there's one medication we use for that. It's called Entresto. And the PARADIGM trial showed excellent benefit for patients to reduce their risk for death and hospitalization. So next we have the beta blockers. That's going to be medications such as metoprolol succinate, bisoprolol, and carvedilol. Then we have the mineralocorticoid receptor antagonist, or MRAs. That's going to include medications like spironolactone or eplerenone. And then last we have the SGLT2 inhibitors, which is a newer class of medication for heart failure. And that class of medication was originally used for diabetes, but we've actually found it's very helpful for heart failure too. That's going to include two main medications used for that, empagliflozin and dapagliflozin, also known as Jardiance and Farxiga. So by combining those four medications, they make up the four pillars of heart failure, and we can improve patients' quality of life, restore their ejection fraction, reduce the risk for going into the hospital, and extend their lifespan.
How does one even get to the point where they're like, having heart failure?
So really there's a variety of causes of heart failure. So certain things like coronary artery disease or blockages in the heart arteries can cause heart failure. Uncontrolled hypertension can cause heart failure, and really a whole host of things.
Can a lot of this be checked? Like if you're doing, your yearly physicals with a doc, will they be able to tell you, oh, heart, because it's not like we're going in and, doing x-rays and stuff. Through blood work and weight and stuff, can you tell if there's heart issues?
So heart failure is a clinical diagnosis, and the main things you're going to look out for is things like getting short of breath when you're doing things. You might start notice swelling in your legs. So if you have any symptoms like that, it's a good time to talk to your doctor.
To talk to the doctor. And if someone is worried about their heart health, what's the best way to get connected with you or someone else at Upstate Cardiology?
Sure. So you can ask your doctor if you need a referral to your cardiologist. You can also call our office to make an appointment, and that number is 864-235-7665.
Well, thank you, Doc. These are good points. Again, it is Heart Health Month. Little changes can go a long way. I know it gets a little overwhelming thinking, oh my gosh, I have to change my whole entire life, but try little things and over a while it'll be so much better. So thank you so much.
Yes, ma'am.
We
Thank you.
appreciate it.